All right, good evening, everyone. Welcome to Phoenixville Library for tonight's program on updating your Medicare for 2026, otherwise known as fine-tuning your Medicare. I guess we'll coordinate the titles at some point. We're pleased to have with us PA MEDI counselor Linda Metz. Linda, take it away.
Thanks. Thanks for having me. I'm glad to be able to try to give you some of the ins and outs of the open enrollment period. I'll give you a little background on me so you know I've been a PA MEDI volunteer since 2009 when it used to be called a prize. If you've ever been involved with this before. And I have a background in healthcare and thought when I would go to do volunteering for PA MEDI that I would really know the whole thing because I've been in healthcare my whole life. Well, that was a rude awakening to the details of Medicare. So I can empathize with all of you in terms of having to figure some things out as you came onto Medicare and as all the changes have come down. So hopefully tonight you'll be able to kind of get a sense of what to look at this year and going forward. And just a tip that we do have a class called Medicare 101. If you have friends who are turning 65, they might enjoy visiting that class because it does go from A to Z with all the details of Medicare, where tonight we'll just kind of concentrate on some of the things that are changing. So that's what's happening, and Laura gave me the magic stick. Okay.
Down to go forward, up to go back.
Down. I'm hitting the up button. Down button.
Down to go forward.
Down.
There you go.
I'm not used to the fancy stick. If I'm in your way, keep going. Okay. Just to let you know a little about PA MEDI is a state health insurance assistance program. When they began with the federal government, they used to be called SHIPs, which is what that stands for. And each state has its own group of programs that they run depending on what the requirements are and what the interest is. They're usually under the direction of some Department of Aging, and in Pennsylvania we're under the Pennsylvania Department of Aging, and locally we're under Chester County's Department of Aging. So the most important thing for you to remember is we're free. We're independent, we're not selling insurance. What information we give you is information that we gleaned from the federal government and the services that they provide to us, so that you don't have to feel if you're coming in, we're going to try to sell you a certain insurance plan. And if somebody tries, you need to let us know, because we're not doing that. All of our volunteers go through a training program that's quite extensive. It's a 6-week educational program, and then they have a 6-month mentorship with an experienced volunteer. And we have all kinds of resources that we can utilize to kind of keep up to speed, and most of us usually get all kinds of regular emails from regular sites that provide information for Medicare. So we'll go next. These are just some of the other services we provide. We basically do Medicare counseling for folks coming into Medicare. We do phone counseling, we do in-person counseling, and we've done Zoom counseling since that's been available to us, so that we're pretty flexible in terms of that. Most of the senior centers in Chester County have a PA MEDI person assigned to them, as do most of the libraries. So if you're trying to find somebody, try either Chester County or your local library or your local senior center, one or the other, that should be able to get you to someone. We also do assistance with folks who are low income. There's a number of benefits that Medicare has for low income individuals. And we do the specific counseling during annual open enrollment, which is October 15th to December 7th. And so that's the time we kind of put our skates and are running from place to place doing very centered counseling. The bottom part there is just things that we do. We do the 101, which is the main program we do for people 65. And then there's a 102 update for people who are on Medicare, and then our annual open enrollment. So you might also see us at different healthcare fairs. So what we're going to start with tonight is some Part D changes. Some of them you may have heard of, some of them you may not yet, but there has been changes in the out-of-pocket cap to $2,100. And that $2,100 also causes an elimination of what used to be called the donut hole and the coverage gap. And there continues to be the optional Medicare prescription payment plan that I'll talk a little more detail about. So the out-of-pocket cap, this includes your plan's deductible and all your co-pays. It does not include your premiums. And it applies only to the drugs that are in your plan's formulary, that list of drugs that they allow you to prescribe from. And as I mentioned, it eliminated that donut hole. So the Medicare prescription payment plan was started because with the $2,100 copay, usually within the first couple months, you may, till you hit that 2,100, you may have costs that maybe something you don't want to have to take in 1 month, you want to spread out over the year, and you are allowed to do it. It's a voluntary program. You work at, excuse me, it's actually administered by the drug plan, and what happens is once you're in the plan, you don't pay anything at the pharmacy for anything. The actual plan bills you on a monthly basis. And for someone who has high expenses that first month, like that they're going to have that $2,100 all in that first month, it's kind of nice to know you can spread it out over the year. I know with my husband, he has some very expensive drugs, and he gets the $2,100 like with third week of January because of the medications. So it's just kind of a way to be able to take the hit a little easier. And you can find information on it in Medicare on You 2006. Have everybody got their book yet? Mm-hmm. We got one. It came to my husband. I haven't gotten one, so maybe they're only sending them to one part of the spouse. And you can also get information from your plan. So those are the places that you can actually take a look at things. And some of the consequences of these changes this year is a lot of drug plans, prescription drug plans, no longer provide a commission to insurance sellers. So some of the insurance sellers aren't selling as many variety of plans as they did in previous years. This doesn't preclude you going to the Medicare Plan Finder and signing up yourself to do that, so that you don't do it with a insurance agent, or from coming to us and us helping you do the plan finder for it. So that's probably the biggest change. The other thing is, if you want to watch, if you're currently getting your drugs through an employee or a union, employer plan or a union, you want to make sure that they're still credible. And credible, they should be, by credible, I mean that they will provide the same level of coverage that a prescription drug plan from Medicare does. And they should be sending you a letter each year indicating that they are still credible. If they are not, you might want to switch to a Medicare plan. So that's something to think about. Scheduling a session with us, the phone number there, the 610-344-5234, is our open enrollment helpline. We won't schedule the appointment there, but we can tell you where you can schedule an appointment, who's offering services. Or again, contact your local senior center, because they're all staffed for the open enrollment period. So, important information about what you should bring if you're coming to a counseling session with us. And it's really important for this information to come, otherwise we're not going to be able to do a thorough job of counseling you. But you want absolutely a list of your medications with the dose and the frequency. You want to have your Medicare card, you want to have your old prescription card, and any other insurance cards you have, like if you happen to have medical assistance, excuse me, or you happen to have any other type of insurance that covers you. Any mailings, you know, those lovely mailings you get every year from all of your plans, you want to be sure to bring them along so that we know what they're communicating to you. And also your Medicare.gov login and password, that's to get to the plan finder. This year there's been some changes in how that works, and they're not requiring new people signing up to get, it's a what do I want to call it? It's not a credit check. It's a check to make sure you who you say you are. But I find it interesting. My husband and I went and looked at his plan. He didn't need to have an email available. Then I went and looked at my plan, and it required an email. So maybe that the things are still getting settled down in Washington. And just what is the Medicare annual open enrollment period? And it's basically your time of year to look at what your coverage is if you have a prescription drug plan or if you have a Medicare Advantage plan. Medicare Advantage plans are those private insurance plans that work with Medicare. And you can make the changes during this time, so you want to look at the premiums, etc. I've had several experiences with clients, including my own husband, that had they not changed their prescription plan, they would have not saved, you've been charged a lot more. I think if we'd stayed with the plan my husband had, we would have been paying out of pocket almost $11,000. So I always say it's worth it to take the time and go through the process. And also your co-pays and premiums change, and sometimes your needs change.
Oh, I just had a question. If the open enrollment is until
December 7th.
December 7th, okay, thank you.
But I'll tell you, if you're coming to see us, if you want some assistance,
Sure.
don't wait till the last minute.
Right.
Things are already filling.
I'm sure.
So here's the October 15th, December 7th, and then your coverage starts January 1st. And this hasn't changed. It's the same. It's been the same every year. So these are some important mailings that you should have gotten by now from your plans, either your Medicare Advantage plan or your prescription drug plan. And that is the plan's annual notice of change. You should have gotten, for instance, your drug plan, you get a booklet usually that has the prescriptions in it that are available. And sometimes it's a notice to go to their online site to look at it. You need to have also from all of your insurances a letter of coverage that says that you are covered by them and will be covered by them until December 31st, because that's part of the insurance lingo. Yes?
Thank you. I already got a letter for my supplemental insurance. I will be paying $90 extra a month.
What we've seen is with Medicare Advantage
It's
rising,
not Advantage.
the Medigap, the numbers of Medicare Advantage enrollees rising, the Medigap plans are increasing their percentages anywhere, we've seen from about 5 to 9%, depending on the company.
But it's not an Advantage plan.
It's a supplement plan.
It's a supplement.
Right, and they're going up.
And then who knows the way the situation's going with our beloved government. Some states will be paying 3 times as much. We won't know until, we'll be surprised.
Mm-hmm. Yeah, I think at least ours is the January is the time we get a new notification. It used to be your anniversary of your birthday, but they've all gone to January now, so it's a yearly change. And then, as I said, Medicare and you will come. This is online, if you prefer to read something online and not have this sitting around. It is available fully online. I'm still old enough that I can't absorb reading online. I have to have it in front of me. And the other note in there is you can always quickly discover what are the changes for this year, because they're always printed on the first page. of the book.
We do have the books here in the library too. We have the books here in the library too.
So this is just some other things you might receive during the Medicare open enrollment. If a notification that your plan is leaving the Medicare program. We've had a lot of phone calls because Blue Cross, Independence Blue Cross, has terminated programs, the personal choice, personal choice plan, that's three, right? 3 personal choice plans. And so people are scrambling to do a what do I do kind of thing. The Blue Cross is maintaining their Keystone plans, they're just getting rid of their personal choice. And frankly, I think the reason they're getting rid of them is that those were sort of their high-end programs. Very, particularly the highest one was a well-designed Medicare Advantage plan. So I don't know if any of you have gotten the notification, but if you haven't, I would start asking. If you have extra help, which is a program that is for folks who have limited income that helps pay for prescription drugs, you'll get a notification whether you still qualify for the coming year. And also any notification that if you're a high-income person, what your new prescription or Part B and Part D premiums will be, so that obviously we'll end up paying more. And of course, I'll always say to everything, don't ignore anything that comes from Medicare. This we have had on in this program for a couple of years. What about all these commercials that you see on TV? I don't know, maybe I just haven't been watching TV that much, but it doesn't seem like they're quite as rampant this year as they usually are. I think what that means is that Medicare Advantage plans have reached a point where they feel they're now 50% of all people on Medicare, on a Medicare Advantage plan. So maybe they feel they don't need to advertise as much anymore. But basically, don't listen to anything they're saying. You know, check a reputable source. They tend to like leave the details out, and the details are the important part. So, what can you change during open enrollment? And basically, the right side of left side of the script is original Medicare, is your Part A, your Part B, a Medicare supplement, and prescription drug plan, and to the right is the Medicare Advantage plan, which you still have to have Part A and B, and how they work differently. So there are things you can change with prescription drug plans, and there's things you can change with your Medicare Advantage plans. And we always have people look at their original Medicare and make sure that that's functioning the way it should. So these are changes that a prescription drug plan can make during the year for the next following year. And that's just about everything that's in the plan could change. And that's why we ask you to really pay attention and look at it. And I think the most common thing that people run into as an issue is that the tier of your drug changes, and the tier affects greatly the price of your drug. And many times we've seen, for instance, a drug that was considered generic gets moved to a brand. They do away with the generic and it becomes a brand. But there are also a lot of drugs that end up in the tier for non-preferred drugs and for specialty tier because they're new drugs. And in fact, my husband's expensive drugs are all specialty tier, so that's why they are expensive. But the pharmacies change in their network, the preferred pharmacies change, and in fact, if you've been on the plan finder, what they categorize drug pharmacies now is a network pharmacy, or an in-network pharmacy, or a preferred pharmacy, which to me kind of sounds the same, but they're not. The preferred pharmacy will get a much better price. So here's the things changing. The cost for a prescription drug, the maximum deductible is going up to $615. And the initial coverage phase has gone up for your out-of-pocket cost to $2,100. And what the part that pharmaceutical companies used to contribute, a 10%, is no longer counted in that. And then your catastrophic coverage phase starts once you hit that cap, and you don't pay anything after that. And that's been very nice for a lot of people. $2,100 is not a cheap amount, but if you take that Medicare prescription plan, payment plan, and spread it out over the years, it's less hurtful, and it's just been a good thing for people that are on a lot of drugs. And this is for people on extra help, and what they've done is they've allowed special enrollment periods each month, so someone on extra help can change their Medicare plans each month if they want to. I don't know why anyone would want to change their plan every month, but some people may during the year find that the new drugs they've been placed on are covered by their plan, and they would have the opportunity to change to a plan that is done. And full dual eligibles mean people who are on Medicare and Medicaid at the same time. And there are special plans that are available to them that actually align with the Medicaid plan. In Pennsylvania, we have something called Community Health Choices, and there's 4 plans this year that medical assistance people, Medicaid people, can choose from. And insulin, a couple years ago, was capped at $35. That's going to continue. The cap is at $35 for insulin that is self-injected, as well as insulin that you have in either a pump or those special little gizmos that go on your arm, kind of thing. The Part D deductibles no longer apply to the insulin product, so that if you're still in your deductible period and you have an insulin prescription to fill, it's still $35. That's how it works, and it's worked really well for most people that I've talked to anyway. For vaccines, there hasn't really been any changes in the vaccines. There's still full coverage for them. They just are covered under different parts of Medicare. Part B gets your flu, your COVID, your pneumonia, and your hepatitis, and then Part D is your shingles, your RSV, and your tetanus, the Tdap. And I'm sure you'll see starting fares for COVID and health fares for flu too. I know it's starting where I live at the moment anyway. There's some other ways that you can cut your costs if you find that even with the prescription drug plan, you still have a high cost. Some of the big market companies like Walmart, Costco, and Target just might even be cheaper than your plan for a specific drug. And you can take a look at that and see. And their charges also change year to year, but they've continued to be within the $10 to $15 and lower range. Most of the plans do have the preferred pharmacies, and there's a significant difference between what a preferred provider provides the cost of their drugs compared to someone who's not a preferred provider, and sometimes it can be pretty significant, so you want to stay with that preferred provider. And oftentimes you'll see that in the plan you have, the drugstore you had may or may not continue to be a preferred provider. So that's something to look at also when you're looking at new plans for your prescription drug plan. And the mail order, which years ago was less expensive, has gone through a phase of being more expensive, but I'm seeing now that several plans I've looked at are now, their mail order is less expensive, so they've kind of been going up and down. I don't know too many people that use mail order anymore, and I suspect it's because of the cost of what it was. These are just some other places you can take resources from to help you figure out drugs or the cost of a particular drug. The Clearinghouse is a Pennsylvania group that does all kinds of help with different assistances in the state of Pennsylvania, so that they can help you with prescription drug costs, but they also can help you with food and nutrition programs. They can also help you with different transportation programs. They're a really good group, and they've got a lot done. GoodRx is fairly well known. I haven't found it really helpful for trying to get a drug for less cost than what my plan does, but I think it's good for people who don't have insurance to be able to use. And then RX Outreach is just another nonprofit pharmacy that helps to provide drugs. And PA MEDI again is more of a resource directing you to different plans that can help you. Another big place too is the manufacturers. If you have a pretty expensive drug that for some reason, even with your prescription plan, it's still going to be expensive. Some of the manufacturers have coupons for the drugs, so that's always a good resource too.
For Medicare, they're usually for commercial insurance only. Do they also do that for Medicare?
Yeah.
Oh, great.
Telehealth, I don't know if any of you took advantage of telehealth during the COVID epidemic. It was widely used and was really helpful for folks to be able to get medical care without having to go out of the house. But it was effective September 30th. It's no longer covered under Medicare, except for some exceptions there. One is that if you live in a rural area, but even if you live in a rural area, you're going to have to go into a hospital or a clinic to actually do the telehealth. You also can have telehealth if you are on end-stage renal disease. They will take you. And I see you chuckling because it was kind of weird because telehealth was always from home. But, and then the next two are diagnosis, evaluation, and treatment of symptoms for an acute stroke or mental health behavioral issues. So those are still there. And the key is to know that if you are performing telehealth with a healthcare provider, make sure that they understand if they don't qualify under those examples, that you're not going to get paid, and they should be providing you what's called an advance notice to a beneficiary of denial. And it's actually a letter you get. These are some things that in the Medicare Advantage plans change, and again, not unlike the prescription plans, the Medicare Advantage plans have changes too. And everything we talked about in the prescription area that changes, with a Medicare Advantage plan that also provides prescriptions, those same things are going to apply. And also their general copays and deductibles and what they allow for preferred pharmacies, all the same kind of thing. It's just going to under the structure of a Medicare Advantage plan. And like the prescription plans, they should have notified you by September 30th if there are going to be any changes for 2026. Open enrollment now, in addition to the October 15th to December 7th, has another additional open enrollment period, January 1st to March 31st. Except during the January 1st to March 31st, there's only certain things you can do in that period. And what you can do is it allows you to either to drop a plan and go back to original Medicare, or make a one-time change to another a Medicare Advantage plan. The one thing I would highlight though, if you're going from a Medicare Advantage plan back to original Medicare, you may have issue getting a Medicare supplement. Insurance plans, after that first 6 months you turn 65, are allowed to do your medical history and decide if they want to take you or not, or whether they'll take you but they'll charge you a higher fee. So just be aware of that. This is just to kind of say, here's the Medicare website and where you're probably going to go to log in and create an account here if you don't already have one, or you can go to Find Health and Drug Plans to get to the plan finder. And we're happy to help you do that.
On the Advantage plan, is it one time a year you make that change, or is it one time your lifetime?
No, it's one time during that second enrollment period, January to March. You can
So
make a
once,
change.
if you're on a plan like that, you're not
Mhm.
stuck with it for the rest of your
Yeah,
life?
the only way I could see people probably using that is that you signed up for a plan in open enrollment from the September to, October to December, and come the first of the year, or maybe even into February, you find out that your primary doctor is no longer in their plan, or the prescriptions that you had are no longer on their formulary. And that might be something that would cause you to make a change like that. That's usually the biggest thing that whatever you have is out of network. So the Medicare account used to be called My Medicare, but the Medicare account is basically your way to get to the plan finder, and also to get to a lot of information, a lot of the information that's in this book that you can search on. And it's just a good thing to have each year. Once you sign up for it, you're in it for life, and you just have to keep track of your sign-on and password. And it also gives you the ability to do your Medicare summary notices. Do everybody know what that is? It's that gigantic list of things that quarterly you get of what Medicare has paid out for you. You can get that online. I would say though, from my own experience, if you're gonna have them go online, I write myself now a note to like quarterly go in and look, just to make sure that everything in there was appropriate. Because what I found was I wasn't doing it, and I was thinking, I don't wanna miss something along the way. The Medicare supplement insurance, the Medigap, some people call it. The only changes related to that, you should review your coverage every year, but again, whether you can change it or not without penalty depends on your insurance plan, but also more importantly, depends on your health. If you're fine, you have not had any changes in your medical history, maybe you're on only 1 or 2 drugs, you may be able to make a change. But if you've had any hospitalizations or you've had any new diagnoses, it's very difficult, if not impossible, to change. And that's part of the problem with the Medicare supplement plan is they continue to go up, but you tend to not change them because I always tell people when they're 65 and they're do I do Medicare Advantage, do I do Medigap? And just so that you understand, if you do a supplement, that when you're 65, you're the healthiest you're gonna be going forward. Because I don't know about you guys, but it seems like every year some other part of me goes wonky. And it just keep that in mind as you do it. It is nice to have a supplement plan because it really, the out-of-pocket costs are the premiums and that's it. But that sometimes is a little bit much for people's pocketbook. And also just a reminder that after 2020, plans C and F no longer are sold. People who were on them at the time were grandfathered in. I worry about them because their pool's getting smaller and smaller, which means probably their rates are really going up. I don't think people are probably gonna run into this, but if you were eligible for Medicare before January 1st, 2020, you can sign up for those plans. Although I really wouldn't recommend it. Actually, F is the most expensive, always was the most expensive plan because it covered the most. And when the government did away with the supplement plans covering your, it just went in out of my head, covering your deductible. Therefore, nobody covered deductible, so the F plan even today is probably the same as a G plan that still is available. Just some things about Medicare, a reminder, you do have the right to appeal. If Medicare refuses to pay for something, you do have the right to appeal, and we can help you do that. I would also say, I had a question last month on our helpline. A gentleman had a particular, I think it was a brace of some kind, and the company that was making it was telling him Medicare wouldn't cover it, so they wouldn't bill Medicare. And I basically told him, you know, you have to get them to bill you, because if you don't have a grounds to go to Medicare and appeal the coverage. So that's kind of something to keep in mind if you do run into that kind of thing. And it always is daunting to people to do an appeal, because there is a lot of paperwork, but that's basically why we're available, to help you do that, help you sort through it. And then also just reminders about fraud and protecting your medical identity as well as your general identity. Not using, protecting your Medicare card and your insurance cards. A lot of people don't carry their cards, which is fine, because if you have them in a safe place, that's good. I do find that sometimes that's hard to kind of filter through my brain, because you may need them at any time, and if you don't have them with you, but that is an option that you can do for that. And usually if you have any kinds of, beware of any kinds of free services that people are offering you. And I haven't had those lately either, so I'm wondering if things have changed. Maybe they're not calling us, well, like, might be because I only have a cell phone now, but when I had a landline, they were calling almost every day. And so with all of that about fraud and abuse and that kind of thing, you do want to have a situation that somebody in your family has access to your Medicare information. And there's a special form you need to fill out. It's that CMS 10106, and it's a simple form. You can send it to, fill it out, send it to Medicare. You can get it online, and you give authority in that for someone in your family to actually speak for you. And as far as married couples, I've always kind of encouraged them not to just use each other, but have someone like a child or an attorney or a friend or something like that that could actually make that call and make decisions. Because Medicare won't talk to you if you don't have that approval. They won't talk to you about someone else. So you might want to think about doing that. And for low-income individuals, there's federal, state, and state programs that help with Part B premium, that help with Medicare deductibles, that help with prescription drug costs. And basically, there's also in the state of Pennsylvania the PACE program. It's PACE/PACENet that helps pay for prescription drugs. And the income level for basically all of those is $33,500 for a single or $41,500 for a couple. And with PACE, they don't look at your assets. Everything else looks at assets. So here's how you can get to us. Our phone number for open enrollment specifically, and also what we call our hotline, helpline, the 344-5004. That's available year-round, so you can call and ask Medicare questions. And I encourage you to use us. We're there. There's about, I think there's about 26 volunteers now in Chester County that we take turns doing the helpline. And then just some other context for you, the Medicare and Medicaid medical assistance program, where you can apply for extra help. PACENet has a website on the web, but you need to be mindful. There's also a program in Pennsylvania for the elderly called PACE that is, it's actually for folks who are to have different types of medical issues, and they would normally be in a nursing home, but the PACE program allows them adult daycare for the day, and then to go home to their home at night. And the Medicare number and the Department of Labor for COBRA. And those are just some good numbers to keep handy. And then we always sort of advertise that we're always looking for volunteers. And there's other things to do in Chester County besides PA MEDI. There's an ombudsman program for long-term care. There's also the advisory council. Senior centers are always looking for people to help out with programming. And then the Chester County Department of Aging itself usually has places for volunteers. So that's the end of my spiel. Yes?
Thank you. What are the hours that you're open when we can call?
Oh, 9 to 5, Monday through Friday. But you can call on the weekend and just leave a voicemail, and the person on Monday will pick it up. And we usually try to get back to you within 24 hours.
With the government cut of employees, has that affected your services?
It hasn't yet, knock on wood. Well, I don't think we cost much because we're all volunteers. We have limited money for flyers and handouts, and the only paid person is our coordinator, and she, I believe, is still part-time. So I'm hoping not. What we counsel on is gonna probably have some effects down the line, because they just haven't gotten to Medicare yet. I think that's closely in the line. Any other questions? Well, thank you for being so attentive.
Thank you.
Thank
And
you.
certainly feel free to call us to answer any questions you have.